in 2020, we were talking about the maternal mortality death. And here we are, we're talking about the death of 66 children. And recently we have seen health ministers resigning from their position due to some weak performances in their ministry. And where we are, you are just 1 year to the next 5 years. What will happen if the health ministry continues to face certain constraints that the ministry is facing at this moment? We see Dr. Samateh resigning from his position.
Now, with regards to me resigning, I first of all ask you, why do you want me to resign? Why? What benefit will my resignation make? What difference? Now, if you say, Dr. Samateh, why are you not resigning? And a lot of other people are saying, Dr. Samateh, please don't resign. As I'm getting a lot of calls today, I think some people had even speculated that I resigned. And so many people called, why are you resigning? Don't resign. You are the best person for this job. You can do it. You've been doing it. You're moving things forward. You are doing this and that and that. So whose instructions should I take if you are to advise? But I think the bottom line is, if I resign, you know I'm a competent surgeon. I can have a lot to do. And so it is not personal. It is not people wanting to stick to jobs. Resignation is an easy way out. There are problems, a lot of challenges. Then you throw the towel into the works. I'm walking off. You can go and deal with the problems that we all know we are dealing with. We are working together to resolve. And if you equally look at, sometimes you balance it. If you want a symbolic resignation, oh, he has gone because, you said maternal mortality is high. Of course, it's going down. So he's gone, maternal mortality is going down, he's gone, and so on and so forth. But I think that is not the essence. Then you compare, this man, what has he been able to bring to this country? What has he been able to do for the health sector? Even people who do not like me, they know I have done very, very well for this sector. They know it. The mindset of the sector with regards to accountability has changed. There are things that people no longer think of in the Ministry of Health because they say that man is there, he's troublesome. Even that mindset alone is good. Yesterday, I was going to JRTS to be part of a panel discussion. A gentleman called me. He said, is it Dr. Samateh? I said, yes. He said to me, I never supported you. I said, well, thank you. So he said, but today I'm calling you to thank you. I say, what is the issue? He said, for your stance with your team, to first of all work very hard to identify a problem in our country, to identify that there is a problem in children, to work together to isolate bacteria, to work together to see a pattern in the death or in the arrival of this patient to hospital, in the death of these children, to suspect drugs, to suspend these drugs, to withdraw these drugs, to test the drugs, and to come up with initial evidence. He said that is a big step for our country because all these things could have been missed and all these things could have been worse. The situation could have been worsened. This trend could have continued if not for the hard work of our team. And quite a lot of people, contrary to what some people say, quite a lot of people think with our limited resources, with our limited material and human resources, with our limited capacity as a country, we did very well to detect this and to come out transparently to the public, to say to them we have a problem in our country, to say to them we have seen the trend, it is not usual, and to be able to suspend the drugs and to be able to contain the outbreak. Believe me, I'm not saying it because I'm health minister. You can ask anyone independently. I think the team did our best. Thank you.